Pregnancy is one of the most extraordinary experiences a woman's body will ever go through. And most people know about the growing belly, the swollen feet, the cravings, the emotional waves. But there is one part of the body that changes dramatically during pregnancy that almost nobody talks about openly. And honestly, it should be discussed a lot more. I'm talking about the vagina. Yes, the vagina changes during pregnancy, and some of those changes are so specific, so precise, that one of them is actually used as a clinical sign to confirm that a woman is pregnant, even before any lab test comes back. Stay with me, because we are going to walk through 5 changes that happen to the vaginal region during pregnancy. And I promise you, by the time we get to number 3, your jaw is going to drop. My name is Dr. Ross, and on this channel we talk about women's health in a clear, direct, and respectful way. The kind of conversation your doctor should be having with you, but often doesn't have enough time for. If you are pregnant, trying to get pregnant, or simply want to understand the female body better, make sure you subscribe so you don't miss the videos we release every week. Now, let's get into it. Before we begin, I want you to understand something important. Everything we are about to discuss is completely normal. These changes are not signs of infection. They are not signs of disease, and they are not reasons to panic. They are the body doing exactly what it was designed to do, preparing to grow, carry, and eventually deliver a new human life. The female body is, in every sense of the word, extraordinary. And understanding what is happening to it during pregnancy gives women something incredibly powerful. The ability to recognize what is normal, so they stop worrying about things that are not a problem and start paying attention to things that actually matter. The first change we need to talk about is swelling. Now, most pregnant women are already familiar with the concept of swelling in the legs. As the uterus grows larger and heavier throughout the second and third trimesters, it begins to put significant pressure on the major blood vessels that run through the pelvis. This pressure makes it harder for blood to return from the lower extremities back up toward the heart, a process known medically as venous return. When venous return is compromised, fluid accumulates in the tissues, and the result is the swollen, puffy ankles and calves that are so common in late pregnancy. But here is what most people don't realize. The legs are not the only area affected. The vulva, the external female genitalia, including the labia majora and labia minora, can also become noticeably swollen during pregnancy. Some women describe it as a feeling of fullness or heaviness in the vaginal area. Others actually see a visible change in the size and appearance of the labia. This can feel alarming if you don't know it's coming, but it is an entirely expected consequence of the same circulatory pressure that causes leg swelling. It tends to be more noticeable later in the day, after prolonged standing or walking, and it usually improves when you lie down and take pressure off the pelvis. So, if you or someone you love is pregnant and noticing that things look or feel a little different down there, bigger, heavier, more prominent, this is why. And it is completely normal. Now let's move to the second change, and this one surprises a lot of women because it involves something you can actually see. The color of the vaginal tissues changes during pregnancy. Under normal, non-pregnant circumstances, the vaginal walls and the tissues of the vulva tend to have a pinkish color, varying somewhat depending on a woman's individual skin tone, of course, but generally in the pink spectrum. During pregnancy, this changes. The tissues take on a distinctly bluish or purplish hue. In medical terms, this is sometimes described as a livid or violaceous coloring, and the reason it happens comes down to blood flow. During pregnancy, the body increases its total blood volume dramatically, by as much as 40 to 50% compared to pre-pregnancy levels. All of that extra blood has to go somewhere, and a significant portion of it is directed toward the uterus and pelvic region to support the growing baby. This massive increase in blood flow through the pelvic vasculature means that the tissues of the vagina and vulva become much more vascular, meaning they contain far more blood at any given moment than they normally would. Because the blood in the veins is returning blood, it carries less oxygen and therefore appears darker in color. When you have a large volume of this darker blood pooled in the thin-walled vessels near the surface of the vaginal tissues, the result is a visible change in color, from pink toward purple or blue. This is normal, it is harmless, and it is simply a visible sign of the extraordinary circulatory changes happening inside the pregnant body. Now, I told you at the beginning that one of these changes is used as a clinical sign to confirm pregnancy. We are now at change number 3, and this is the one I want you to pay very close attention to because it is genuinely fascinating from a medical perspective. The vaginal artery pulses during pregnancy. Let me explain what that means and why it matters. The vaginal artery is a small blood vessel. Under normal, non-pregnant circumstances, it carries a relatively modest volume of blood, and its walls are thin enough that the pulse created by the beating heart is not detectable from the outside. When a physician performs a vaginal examination on a non-pregnant woman, they do not feel the vaginal artery pulsating. There is simply not enough pressure and volume in that vessel for the pulse to be palpable through the vaginal wall. During pregnancy, everything changes. The increase in blood flow to the pelvic region is so dramatic that the vaginal artery becomes engorged, fuller, under higher pressure, carrying a significantly greater volume of blood with every heartbeat. And because of this, when a physician performs a vaginal examination on a pregnant woman, they can actually feel the vaginal artery pulsating against their fingertips. It is subtle, but it is unmistakable once you know what you are feeling for. In fact, this sign is so reliable that historically, and even today in clinical practice, a physician who detects this pulsation during a vaginal exam can use it as a physical indication that the patient is likely pregnant, even before laboratory confirmation. Think about what that means. The body is so fundamentally transformed by pregnancy at such an early stage that even the pattern of blood flow through a small artery in the vaginal wall becomes detectably different. That is the level of change we are talking about. This sign has a formal name in medical literature. It is part of a cluster of early pregnancy signs that physicians have observed and documented for well over a century. The next time someone says, "Women's bodies aren't that interesting from a scientific standpoint," I want you to remember the pulsating vaginal artery, because that is extraordinary. Moving on to the fourth change, vaginal discharge increases significantly during pregnancy. Now, I want to be very specific here, because the word discharge often causes women to worry, and in this context, it absolutely should not. The discharge I am describing is called leukorrhea, and it is a completely natural, physiological response to the hormonal changes of pregnancy. It is thin, milky, or whitish in color, and it has little to no odor. It is not itchy, it does not cause irritation, and it does not require any treatment. The reason this discharge increases during pregnancy is largely due to the hormone progesterone, which is produced in large quantities throughout the gestational period. Progesterone stimulates the cervical glands to produce more mucus, which combines with normal vaginal secretions to create this characteristic discharge. In the early weeks of pregnancy, the amount may be only slightly more than what a woman is used to. But as the weeks go on and the pregnancy progresses, the volume increases. By the time a woman reaches 37 or 38 weeks of gestation, the discharge can become quite substantial, heavy, milky, and almost constant. This is the body's way of keeping the vaginal environment healthy, maintaining appropriate pH balance, and protecting the birth canal from infection as it prepares for labor and delivery. One important note here. While normal leukorrhea is odorless or nearly odorless, white or slightly yellowish, and non-irritating, any discharge that smells strongly, causes itching or burning, appears green or gray, or has a curd-like texture could be a sign of infection, bacterial vaginosis, a yeast infection, or a sexually transmitted infection, and should be evaluated by a healthcare provider promptly. The key distinction is whether the discharge is causing symptoms. Normal pregnancy discharge does not cause discomfort. If it does, that is a signal to seek care. And now we arrive at the fifth and final change. And this one is perhaps the most remarkable of all from an anatomical and physiological standpoint. The vaginal tissue itself becomes softer, more elastic, and dramatically more capable of stretching during pregnancy. Here is something that almost every woman who has never given birth has wondered at some point. How is it physically possible for a baby's head, which measures approximately 10 centimeters in diameter at term, to pass through the vaginal canal? If you have ever thought about this and felt like the math simply does not work, you are not alone. It seems impossible, and yet it happens millions of times every single day around the world. The answer lies in a series of biochemical changes that begin occurring in the vaginal tissue during pregnancy. Under the influence of pregnancy hormones, particularly relaxin, estrogen, and progesterone, the composition of the vaginal wall changes dramatically. The tissue loses a significant proportion of its rigid collagen fibers, the proteins that normally give it its structural firmness. In their place, the tissue develops a much more extensible, elastic quality. The muscles of the pelvic floor also undergo changes that increase their capacity to stretch without tearing. Increased blood flow to the region further softens the tissue and enhances its flexibility. The result is a vaginal canal that, by 36 or 37 weeks of pregnancy, has the physical capacity to dilate to a degree that would have been completely impossible just months earlier. By the time active labor begins and the hormones of labor, including oxytocin and prostaglandins, are released, the tissue has reached its full potential for extensibility. The cervix, which has been tightly closed throughout the pregnancy, begins to efface and dilate. The vaginal walls stretch to accommodate the descending baby, and what felt anatomically implausible becomes not only possible, but natural. This is why preparation matters so much. Many obstetricians and midwives strongly recommend that pregnant women work with a pelvic floor physical therapist during the third trimester. A skilled pelvic floor PT can help a woman understand her own anatomy, practice the specific muscular coordination required for pushing during the second stage of labor, and use tools like perineal massage or gentle dilation training to help prepare the tissues for the demands of childbirth. Women who arrive at the delivery room, having already practiced and trained that muscular coordination, are at a significant advantage over those who are experiencing it for the very first time in the middle of active labor. If you are currently pregnant and you have not yet seen a pelvic floor physical therapist, I would strongly encourage you to look into it. It can make an enormous difference in how your labor and delivery experience unfolds. So let's bring all of this together. During pregnancy, the vaginal region undergoes 5 major categories of change. The vulva and vaginal tissues can become swollen due to increased pelvic pressure and compromised venous return. The color of the vaginal tissues shifts from pink toward a bluish or purplish hue as blood volume increases dramatically. The vaginal artery becomes palpable and detectable on examination, a sign so specific to pregnancy that it has been used clinically to confirm gestational status. Vaginal discharge increases in volume throughout the pregnancy, driven by hormonal changes, and is a normal and protective phenomenon as long as it remains odorless and non-irritating. And finally, the structural composition of the vaginal tissue itself changes, becoming softer, more elastic, and capable of a degree of dilation that was simply not possible prior to pregnancy. Every one of these changes is purposeful. Every one of them serves a function. The female body does not change randomly during pregnancy. It changes with extraordinary precision, following a biological blueprint that has been refined over millions of years of human evolution. Understanding these changes is not just medically interesting, it is empowering. When a woman understands what her body is doing and why, she is better equipped to advocate for herself in medical settings, to distinguish between what is normal and what needs attention, and to approach the experience of pregnancy and childbirth with confidence rather than fear. If this video gave you something useful, a piece of information you didn't have before, or a sense of reassurance about something you were wondering about, please share it with someone who might need it. And if you have questions about anything we discussed today, leave them in the comments below. I read every single one. My name is Dr. Ross. I'll see you in the next video.